At 79 years old, Donald Trump became the oldest person to assume the presidency in American history. Yet recent months have painted a picture that contradicts his claims of perfect health. Behind closed doors and during public appearances, a pattern has emerged that medical experts find increasingly troubling. This is the story of what's actually happening with the leader of free world's health, a narrative that goes far beyond a simple aging. The question isn't whether Trump is old. The question is whether those around him are telling us the full truth about what is his body and mind are telling them. In July 2025, photographs emerged that reveal something the White House has been keeping quiet. Trump appeared with noticeably swollen ankles and unexplained bruising on his right hand. The immediate response came through his physician. The leg swelling was due to chronic venous insufficiency, a vein condition that prevents blood from traveling properly back up from the legs to the heart. A bruising, they claimed, resulted from frequent handshakes combined with his daily aspirin regimen. But here is what the medical science tells us about chronic venous insufficiency. This is a real medical condition that affects roughly 1 in 20 adults, primarily those over 50 years old. When veins become damaged or weakened, they struggle to push blood against the gravity back towards the heart. Blood pools in the leg, pressure build up in the smallest blood vessels, and fluid leak into the surrounding tissues. The result is swelling, heaviness, aching and cramping that worsens when standing and improves when legs are elevated. Research shows that advanced age is a critical risk factor. The older you are, the more likely your veins have accumulated damage from decades of use. In elderly patients, this condition becomes even more concerning because it significantly increases the risk of blood clots forming deep within the leg veins and potentially a life-threatening situation. His physician recommended compression socks, a standard treatment that increased the pressure in the legs and help push the blood upwards. Trump refused them. Instead, he reported standing up more frequently from his desk to help with the swelling. Actually, in advanced venous insufficiency, standing actually makes things worse by increasing the pressure in the legs. The bruising explanation demands scrutiny. Yes, aspirin thins the blood, and yes, Trump shakes many hands daily. But frequent bruising across the hand that requires makeup concealment raises questions beyond simple cosmetic concerns. His medical regimen includes daily aspirin. While aspirin at low doses can help prevent heart attacks and stroke in some people, it also increases the bleeding risk. The bruising on his hand was attributed to this combination of aspirin and frequent handshake. However, this raises a question. Why is a 79-year-old who claimed a perfect health on a blood thinner? Typically, aspirin for cardiovascular prevention is prescribed after someone has had a cardiovascular event or has high risk factors. The White House hasn't clarified which category Trump falls into. By November 2025, a new pattern became undeniable. Trump's public schedule has fundamentally changed. Unlike his first term, when he maintained an aggressive, unpredictable schedule that sometimes ran past midnight, his current calendar looks carefully constructed. Most appearances happen between noon and 5 p.m., the middle hours of the day. Shorter, more contained windows. During an Oval Office meeting on November 6, Trump sat behind his desk while executives discussed weight loss medications like Ozempic. After approximately 20 minutes, his eyes began to droop. This wasn't an isolated incident. Multiple people and his friends reported having to speak loudly during the meetings with the president because he struggles to hear. Hearing loss is a documented aspect of aging, particularly in men at advanced age. More concerning was the pattern of fatigue during official duties. Medical research on aging in 70s and 80s revealed important facts about sleep and cognitive function. The brain requires adequate sleep to consolidate memories, clear toxic proteins, and maintain optimal function. Trump has been documented as getting very little sleep, a habit he's maintained for decades. In advanced age, sleep deprivation compounds other cognitive stressors. The apparent microsleeps, brief episodes where someone's eyes close for seconds while they nod off, weren't just about tiredness. They represent something more of a neurological signal. These episodes suggest the brain is struggling to remain engaged during relatively low stress activities. Combined with hearing difficulties, the emerging picture was of someone experiencing accelerated fatigue that public appearances couldn't hide. In early 2025, Trump began an unusual pattern with cognitive testing. In April, he took the Montreal Cognitive Assessment, a test that is designed to detect early dementia and mild cognitive impairment. He scored 30 out of 30, a perfect score. In October, only 6 months later, he took it again, another perfect score. By late 2025, he had taken the test for third time, again claiming a perfect result. Then he posted on Truth Social about acing the third test, calling it a major achievement. This is where medical experts raise a serious alarm bells. Here is what you need to understand about MOCA test. Medical professionals use it to screen for dementia in people aged 55 to 85. It takes about 10 minutes and evaluates 7 domains of cognitive function: executive ability, naming, attention, language, abstract thinking, memory recall, and orientation to time and place. The test contains 30 questions. A score under 26 suggests that a possible mild cognitive impairment or dementia. But here is the critical part that caught everyone's attention. You don't take the MOCA repeatedly unless something is concerning you. Dr. John Gardner, a clinical psychologist who specializes in assessing public figures, explained the implication directly. Taking a screening test for dementia once during an annual checkup is normal, especially at age 79. Taking it again 6 months later is not normal. Taking it third time within the year is definitely not normal. Only reason to repeat a dementia screening test 6 months apart is if you are cross-monitoring someone for cognitive decline. It suggests his medical team suspect an issue and wants to track whether it's getting worse. The White House hasn't explained why these repeated tests were necessary. If Trump was in perfect health, with no health concerns, the test wouldn't be happening multiple times yearly. Beyond the visible symptoms, medical professionals who study movement and motor function begin noticing something alarming. Trump's physical coordination appeared to be deteriorating. Psychologists analyzing his public movements identified what they called a wide-based gait, a particular way of walking where someone spread their legs wider than the normal and swing their legs in a semicircular motion rather than walking naturally. In medical terms, this is a recognized sign of certain neurological conditions affecting the cerebellum and basal ganglia, the structures that in the brain that controls movement and coordination, including certain type of dementia. More specifically, it has been identified as a potential sign of frontotemporal dementia. What is frontotemporal dementia? Unlike Alzheimer's disease, where memory loss is usually the first sign, frontotemporal dementia typically begins with personality and behavioral changes. The disease causes inappropriate behavior, emotional problems, loss of social inhibition, reduced empathy for others, and language difficulties. Physical symptoms develop later and can include the movement problems identified in Trump. Behavioral changes are very profound. The people with early stage of frontotemporal dementia often become inappropriate, rude, or emotionally cold. They lose their ability to empathize with others. They develop repetitive behaviors. They may overeat or develop obsessive habits. These changes are often precede memory problems by years. Trump's public behavior includes increased impulsivity, harsh language towards critics, obsessive posting patterns, and apparently emotional rigidity mirrors some patterns that observed in people with cognitive decline.
Admitted to releasing the full video?
Didn't I just tell you that?
You said that it was
You're
up
the
to
most
Secretary Hess.
obnoxious reporter in the whole place. Let me just tell you, you are an obnoxious, actually a terrible reporter. And it's always the same thing with you. I told you, whatever Pete Hegseth wants to do is okay with me.
He doesn't exercise regularly. Trumps hold a long-standing personal belief that humans have finite amount of energy like a battery that depletes with use. and that the vigorous exercises is useless. This contradicts the medical evidence. Studies consistently shows that regular physical activity protects the brain, improves the blood flow, strengthens the cardiovascular system, and reduces the dementia risk. The American Heart Association recommends at least 150 minutes of moderate intensive aerobic activity weekly for optimal health. Trump's exercise consists primarily of golf, which provides some activity but isn't comparable to structured cardiovascular training. His diet is well documented. Trump prefers red meat, salty food, and fatty processed food like McDonald's, hamburgers, and fries. He frequently consumes large quantity of these foods. Medical research definitely shows that diets high in saturated fat, salts, and processed food increase cardiovascular disease risk, promote inflammation throughout the body, including the brain. The central issue in this story is what we don't know and what the White House won't explain. In October 2025, Trump underwent imaging at Walter Reed Military Center. Initially, the White House refused to explain what imaging was performed or why. Trump told reporters he had an MRI with perfect results.
No. What part of your body was the MRI looking at?
I have no idea. It was just an MRI. What part of the body? It wasn't the brain because I took a cognitive test and I aced it. I got a perfect mark, which you would be incapable of doing. Goodbye, everybody. You too.
Later, the White House clarified it was actually a CT scan. That's absolutely a different test. This vagueness is unusual. Medical records are legally protected, but presidents typically allow the release of summary information. In this case, the lack of clarity raises questions. Was the imaging truly normal? Why the initial confusion about what test was performed? Why can't Trump or his physicians clearly articulate what was found? Dr. Jonathan Rayner, a cardiologist who has commented on presidential health, pointed out that preventive cardiac MRI is not a standard practice for a 79-year-old man. Advancing imaging is typically ordered when there is a clinical concern, not as routine preventive care. If Trump's health was fine, why the imaging? If the results were truly perfect, why not release them? The White House strategy has been to dismiss the concerns about Trump's health while refusing to provide specific details about medical evaluations. Medical professionals who study cognitive decline and brain health have become increasingly vocal. Dr. John Gardner, a clinical psychologist who has assessed thousands of people, said directly, "It's evident to anyone that this man is deteriorating both mentally and physically." He elaborated that Trump's behavior shows emotional rigidity, lack of restraint, and decisions that simply does not make sense, pattern consistent with frontal lobe dysfunction. A president showing signs of physical fatigue, cognitive monitoring through repetitive testing, visible health issues, and behavioral changes that might indicate neurological concerns deserves more than reassurance and vague medical summaries. The public deserves a clarity. At 79 years old, Trump is the oldest president in American history. Aging itself is not disqualifying, but aging accompanied by managed symptoms, repeated cognitive monitoring, and decreased physical capability raises legitimate questions about the leader's ability to handle the most demanding job in the world. Medical science is clear. Age combined with no regular exercise, poor diet, and sleep deprivation and cognitive concerns create an urgent health picture. Whether Trump is experiencing simple age-related changes or more serious cognitive decline cannot be determined without detailed evaluation and transparent disclosure. What we know is this: the symptoms are real, the pattern is concerning, and American people deserve answer more complete than a physician's brief reassurance that everything is perfect. The question isn't whether Trump is aging. Everyone ages. The question is whether we are being told the whole truth about what that aging means. Thank you so much.